Welcome to episode 110. I'm Stuart McCullough, I'm the CEO of VHIA. And it's time for this week's Industrial Roundup. For this week's Industrial Roundup, and starting with community health, the major activity that we've been involved in is preparing a response in the form of a submission with respect to the regulations accompanying the Long Service Benefits Portability Act. As previously indicated, there are two major concerns with respect to the regulations. The first of those concerns goes to the issue of clarity as to who is covered by the scheme. Those concerns at this point are unresolved by the regulations. And the second concerns the anti-double dipping provisions. It remains our view that they cannot have complete effect for the reasons that we've previously outlined. A copy of our submission is available through the community app and the VHIA Yammer network. With respect to our health service members, on Monday we're attending a meeting of the Rural Health and NPS CEOs to give them a briefing about the general themes underpinning the draft Nurses and Midwives log of claims. We're also attending a meeting for CWMS for the Mental Health Agreement, and there's a meeting also with the AMA concerning the savings schedule provisions. On Wednesday, we're meeting with the MSAV following the RMIT report and our correspondence that we provided, which rejected that report. On Thursday, we're scheduled to meet with DHHS, specifically to discuss the mixed ward provisions of the Safe Patient Care Act, which we know has been a concern to a lot of members. And on Friday, we're attending a meeting of a safety committee. Much of our activity at the moment is focused on the preparation of the log of claims for nurses and midwives. And I'll just indicate that later this month, our members can expect to have distributed to them the finalised version of the VHA bargaining framework, which will be a written description of how bargaining works. That will be accompanied by an executive summary also. That's it for this week's Industrial Roundup. It's now time for the weekly update. Welcome to the weekly update, where we go in depth with a particular subject. And joining me for this week's discussion is the Manager of Workplace Relations Services and recently converted self-identifying gymnast enthusiast, Tim Nagle. Welcome, Tim.
Thanks, Stuart. Good to be here.
Tim, normally at this point we would reveal a clue, but there's no revealing to be done. We have instead a very, very large pile of documents. And on the basis of this gargantuan pile of documents, would you like to guess at what the subject is for today? Would you like to also guess what these documents are?
So I can see that there are enterprise agreements. So I'm assuming, given that there's a pile of the enterprise agreements, then we're looking at the librarian classifications in the Health and Allied Services Agreement.
Tim, as an effort, I would describe that as heroic, but it's incredibly wrong. These are, in fact, this gargantuan pile is actually all of the agreements that apply to public health services. And we should just give a little bit of a sense of scale with regards to that. So, because secretly you and I are 10 feet tall, I've prepared this Smurf just to put next to it and just to get an idea of how big that list of agreements is once you put them on top of each other. So those are the public sector agreements. It takes us to really, in an indirect way, to our theme for today, which is to talk about the preparations for the log of claims for the Nurses and Midwives Agreement.
So just in terms of those agreements, how many agreements are there?
So there's a dozen agreements here in total. They span several thousand pages and they weigh about 1.2 metric tonnes.
So nearly 1.5 tonnes?
Well, I made that last bit up, but the rest of it is true. There are 12 agreements spanning some several thousand pages.
So what's the significance of that?
So this pile of documents that you see, these are the industrial terms and conditions that apply within Victoria. These are the industrial regulations that apply to employees within the public health sector.
So to put it another way, this is what our agreements would look like if they were, for example, a huge hamburger.
Correct. So I think we have those images side by side. Tim, I think the agreements are on the left.
So what's the practical effect of that?
So what that gives an indication of is the large number of rules that apply to different employees. And what it means in a practical sense with 12 different sets of regulations, many of them covering the same territory, is that one action by an employer could attract 12 different sets of regulations.
And that sort of regulatory framework is not the normal?
That's correct. It's a really unusual thing to have that kind of divergence of responsibility. And it leads us to one of the key themes for our log of claims, which we'll get to in just a moment. But first of all, what we're going to do is cover off some of the background.
What is a log of claims?
So a log of claims is a statement that sets out what a party is seeking from a negotiation. So unions will prepare a log of claims and employers will prepare one also.
So I've seen some log of claims where they seem to have gigantic demands in them. Is that normal?
Yeah, it is. So those are often referred to as ambit claims. And an ambit claim sets out a position probably representing an outer limit of what a union is seeking, and it comes with an expectation almost that the other party will seek to negotiate back from that unfavourable position.
So, well, that means that the other party, because they've negotiated back from that really bad position, see the new position as favourable.
That's right, or simply as less bad.
Yes.
So that's an example of what we would describe as positional bargaining, and that's what's historically happened within our sector. Where we would like to get to is to an interest-based approach.
And in an upcoming podcast, we'll explore the differences between positional bargaining and also interest-based bargaining. So just in terms of where we're up to today, what are the procedural steps involved in preparing a log of claims?
So let's start with a reminder of some of the key dates, and those are up there on the screen. You can see there's a table of dates, including the date that we need to have a log of claims ready to submit to the department. That's got to be 3 months before bargaining is due to commence, and that in a practical sense means that we've got until the 30th of June of this year to prepare our log of claims for the Nurses and Midwives Agreement.
So just in terms of that timeline, the 3 months prior to, where does that rule come from?
So it's set out within the government's wages policy. Members who want to know more about the wages policy can find that information in podcast episode 105.
So the draft log of claims goes to the department on the 30th of June. What happens once it goes in?
So generally what happens to that document, it's reduced down to its key elements. It becomes a shorter, more general statement based on the log that we've submitted.
Sure. So the end result is a smaller log?
That's true, but the detail work that we've done sits behind it. And so whilst there is that reduction down to the bare elements and general themes, the work that's done to prepare the log of claims sits behind it and is very useful when we get to negotiating.
So in other words, some things might come out of the initial draft?
Absolutely, that's possible. So under government policy, they reserve the right to do that, and they oversee the bargaining process. And that's particularly the case with major agreements, which the Nurses and Midwives Agreement has certainly been identified as a major agreement, but so have the other, most of the other agreements that come up over the next 12 months.
So in terms of VHIA, how is the log developed?
So a large part of it comes from the work that we've been doing over the past 3 years or so. In particular, work that comes out of that 4 stages of bargaining process.
So it's on screen now, the 4 stages of bargaining. That's the bargaining, implementation, review and planning?
That's right. So we've been collecting issues over a period of time as we've undertaken activities through those stages, including with reference groups, our monthly HRIR manager meetings, our rural and regional forums, and meetings that we've attended, such as the various Director of Nursing meetings.
So we've been collecting issues over a very long period of time.
That's correct. So part of the challenge is then to think about how those different issues relate to each other. What are the overarching themes?
And in terms of those themes, what are the key themes, or what do they look like?
All right, let's go through those key themes, and starting with element 1, complexity equals cost.
So we saw our stack of agreements earlier. What's the theme that arises as a result of that rather large stack?
Complexity. In particular, complexity equals cost. Each one of those agreements operates pretty much like a separate country. They're not directed to the needs of health services as organisations. Over time, what we'd like to do is have the agreements look like they belong to one organisation, as opposed to 12 separate organisations.
So if we just come back to complexity equals costs again, what exactly do we mean by that?
It's almost easier to start with what it doesn't mean. When we talk about complexity equals cost, we're not talking about entitlements in a general sense. We're talking about complexity without benefit. Where the cost is associated, there are costs associated with the complexity that outweigh the benefit.
And what's an example of that?
For example, if a particular thing requires manual intervention rather than an automated approach under a payroll system, that could be a circumstance where the cost associated with administering something is greater than the benefit.
So complexity obviously is a big theme. What's an example of, what are other examples of complexity?
So you can break complexity down into a couple of key features, and those are a lack of commonality and a lack of efficiency.
So if we start with commonality, what's an example of a lack of commonality?
So there are some really simple things we want to do in this space, and for example, have a common structure for our agreements.
So that the order that clauses appear in is consistent across agreements? Is that
That's correct. At the moment we have a number of common clauses, but we want to do more in that space.
Because there are some minor differences between agreements that we'd like to address to get more uniformity, is that one of the goals of that?
Absolutely. So we want to get the minor variances on existing common clauses and iron those out.
Yeah.
But we also want to increase the number of common clauses. These are the terms that appear in most, if not all, agreements that don't need to be different.
So if we look for some obvious examples, there's things like the anti-discrimination clauses, daylight savings, parental leaves, those sort of things.
That's correct. So those are additional common clauses. There's also another idea of simply having a common structure for clauses, even where the entitlement varies. So that is that we would structure the entitlement in a consistent way, so the same sequence of events is followed. And all of that is directed to making agreements easier to follow, terms easier to find, and making it easier to understand.
So it's a key concept, isn't it? Make it easier to understand and easier to use.
That's right. So health services and the employees covered by these agreements, both whether you're administering the agreement, whether you're subject to it, you need to be able to understand the terms that apply.
And just to be clear, it's not uniformity of entitlement per se?
No, we're not talking about uniformity of entitlements by reducing entitlements or going to the highest common denominator. We're looking for things that can be common, that don't need to be different.
Yeah. So that covers commonality. A lack of commonality across agreements results in costs through complexity. What about inefficiency?
So there are lots of examples of inefficiency, and we've touched on one of those already in terms of how agreements are understood. Are they clear? Are they clearly written or not? We want to rewrite the terms of some agreements to make them clearer.
What's an example of that?
Another example would be terms that have been the subject of disputes during the life of an agreement.
Yeah.
There's little point in having an agreement that's not agreed. And where disagreements have arisen, we need to look to resolve those disagreements where that's possible, rather than perpetuate those disagreements, because it sort of begins to make a mockery of the idea of an agreement.
So, I mean, obviously where there's disputation over the life of agreement is evidence that it's apparent that there's not agreement over the clause.
That's right. We want to get to mutual understanding.
Now, you mentioned terms that require manual intervention before.
Yeah, so manual intervention is a pretty inefficient way to go about things, particularly when you take into account the number of people within our sector. So the question in that circumstance is whether the benefit is greater than the cost of the manual intervention or not.
So that's complexity. What else? What other elements will the employer log of claim address?
Let me get what I want this time.
So we need to talk about workforce. There are lots of examples where the issue of workforce arises that we will need to engage with.
I know that specialties and the development of staff within specialised skills could be an issue across the sector.
That's correct, and sometimes it's not just about the numbers of people who are available within the entire workforce, but the number of people with specialised particular skills.
What about classification structures?
So there are always questions about classification structures as to whether they're appropriate and up to date. In some instances, a classification structure might put a value on something, which then acts as a disincentive for something we actually want to encourage, such as collaboration between health services.
So geography might be an example. That is whether you do the same work in more than one spot.
That's right. I mean, I think those sort of criteria represent a different time, and we actually want to encourage people to do that rather than discourage through a price disincentive. So, yeah, putting a price on things that we want to encourage is an example of where it might be out of step.
So we may indeed have instances where there's a disincentive of practices that, in fact, as you said, we want to encourage.
That's right, and we've just got to question whether there are barriers to the use of existing staff in terms of their use to meet the needs of health services, and that's an idea that's encouraged through the state government wage policy. That's especially so for small rural health services where the proportion of full-time staff to part-time staff can be much smaller. There might be far fewer full-time staff, so the ability to use that resource as effectively as possible becomes really important.
And that reference to a small rural health service raises an interesting point.
It does. So in the context of the Nurses and Midwives Agreement, one of the issues that we need to face up to is whether the document is biased. That is, whether it is primarily directed towards a nurse who works in a 24/7 medical surgical ward, probably within a metropolitan hospital. And that is a kind of service, but it's not the only kind of nursing service.
So it's really making sure that the agreement's suitable for all the employees it covers.
That's right.
What about the third element?
So those who have watched episode 105 already will know that there's a newly released state government wage policy. So spoiler alert, we're going to talk about that now. So aside from wages, there is a requirement to have a best practice employment guide. There's also a pillar that talks about strategic changes which may have an additional cost impost.
So what does that mean for the log of claims?
So what it means is that we need to actively engage with the elements that are highlighted as priorities under that state government wage policy. So that document is about 10 pages long. There are 10 references or thereabouts to fiscal, financial risk or responsibility. There are 7 references to gender equity. So it would be fair to say that that's an identified issue that we need to turn our mind to.
And how do we prepare to engage with those issues?
So we've been meeting with external stakeholders to develop our thinking so that we're prepared. And so those are the 3 elements in our log of claims. That is, that we'll be dealing with complexity, that we'll be dealing with workforce, and we'll be dealing and engaging with the state government wage policy, the state government's wage policy. The question then becomes, what do we do now?
So from our perspective, we're meeting with our reference groups, we're consulting with members through the monthly IR-HR meetings, we are meeting with DONs and other groups to try and get some input into that process, and of course we'll distribute to those groups the final draft that's being submitted.
Okay, anything else?
One other thing, we want members to be involved throughout the process, obviously. So we've got new volunteers for some of our reference groups, including the nurses and midwives. So that invitation has gone out by a bulletin. So we would encourage people to sign up to that and notify us through the VHIA that they're interested in joining the reference group. We'll also be using GoToMeetings to conduct those meetings so that geography is not a barrier to participation. So we would really encourage participation in the process as has been established.
I just want to emphasise that switch to GoToMeetings means that rural and regional members can participate in the exact same way as Metro members, and for Metro members it's less disruptive. You don't have to come out to our office, you can participate from your office, and as we get into bargaining it means we can have more frequent meetings that are of a shorter duration and make sure that flow of information is working.
And of course we'll always post updates on the app and on the Yammer network.
Terrific. Well, thank you, Tim, for joining me in that discussion with regards to the Nurses and Midwives log of claims.
My pleasure.